Okay.
Okay. So hello, I'm Dr. Shireen and I will ask you some questions. Is it okay for you?
Yes, doctor.
Okay. So first of all, what's your name?
My name is Wilson.
How old are you?
I am 75 years old.
Okay. What do you do?
I worked as welder.
Okay. So where do you live?
I live in Lenina.
Okay. So what's your complaint?
I have difficulty in swallowing.
Okay. Do you have any pain?
No pain.
Okay. Do you feel thirst?
No thirst.
Okay. Do you have cough?
No, no coughing, but sometimes coughing with white sputum.
Alright. So what's your body temperature?
It is 37.2 Celsius.
Okay. Do you experience anything else?
Yes, I feel sometimes weakness,
Okay.
discomfort at present, bad appetite, and hoarseness in voice.
Alright. So how's your urine?
Low urine output.
Okay. So from when you have these signs?
From 5 months.
Alright. So do you have any allergies?
No.
Alright. Do you have trauma?
No.
Okay. Do you experience constipation?
No.
Okay. Do you have fever?
Yes.
Okay. Do you have myocardial infarction? Stroke?
No.
Okay. Any blood transfusions?
No.
Okay. Do you smoke?
Yes, 1 packet daily.
From how many years?
20 years of age.
Okay. Do you drink alcohol?
Yes, sometimes like 4 to 5 in a month.
Times in a month. Okay, okay. So do you have bronchial asthma? Gastric ulcer?
No.
Hypertension?
No.
And do you have diabetes mellitus? No.
No.
Do you go to doctor?
No.
Took any medicines?
No.
Okay. Any past health history or family history you have?
No.
Okay. Okay. Do you had any operations?
Yes, appendicitis in 20 years of age.
All right. So for the conclusion, I think it indicates lung problem, suspect lungs infection such as TB. You need to do further investigation.
Okay, doctor.
Hello, I'm Dr. Shireen. I'm going to perform objective examination. Is it okay for you? Okay. The condition of patient is not satisfactory because he is having difficulty in breathing, and while looking the patient's face, patient looks older. So the patient weight is 45 and height is 155 centimeter. Patient's skin is cyanotic, lips and pale skin, and no bruises in the skin. Okay. And nails and hair normal. Non-subcutaneous tissue looks normal, symmetrical development, and deposits of fats are present at the abdominal region.
Now I'm going to check and examine the lymphatic system. It indicates normal lymph nodes, no enlargement of lymph nodes, no color change on skin above lymph nodes, temperature above the projection of lymph nodes are normal, peripheral lymph nodes are invisible and unpalpable.
And for the muscular system, normal. For checking bones and joints, I will look through the first upper extremities and then lower extremities. Is there any deformities or swelling or problems?
So there is no problem, no swelling, no color changes on joint. Temperature above joint is normal, painless palpation and no fluctuation. Active movements, normal mobility of joints, no change in joint circumference.
Okay, so the bones and joints are normal.
So for inspection of vertebral column, the shape looks normal, no pathological curvature, no deformities. The palpation of paravertebral points are painless. Spinal column movement is active. No pain, no cryptation.
Now I'm going to palpate his head, neck, lips. I will start with head. So there is no tumor, no scar in the hair, in the head. It looks normal. By observing the nose, there is no sputum deviation or herpes nasals or no polyp lice. It looks normal. सही से करो कुत्ते समझ हो. After checking the eyes, it is placed symmetrical, no hemorrhage, no jaundice sign, and there is normal cornea and good accumulation. And checking the lips, it is cyanotic lips and peel in the skin. Now I'm going to palpate the neck. So there is no swelling or no enlargement of thyroid glands.
On examination of GIT, oral cavity is checked. There is no foul smell, no cariosis, comes pink in color, no bleeding, no ulceration, gray edges, mucous membrane hard and soft palate, pinkish color, no cleft, tonsil smooth and not enlarged. Bowel sounds normal, present normal peristalsis, superficial palpitation shows soft abdomen, painless, no tenderness, no local tension, absence of hernia, pancreas not palpable, sigmoid is palpable and painless, cecum is palpable and painless, soft ascending colon palpable and painless, transverse colon is palpable and painless, McBurney point painless, Blumberg sign is negative. Liver and spleen has no scars, no enlargement. No cardiac humpback, present point of maximal impulse, apex beat at the fifth intercostal space. Can you feel pain? Apex beat palpable at the fifth intercostal space. Normal amplitude, moderate strength, no systolic or diastolic beats detected. Aortic arch and pulmonary arch pulsation normal. No cardiac beat. Right border of cardiac dullness is detected in the fourth intercostal space. Left border of relative cardiac dullness is detected in fifth intercostal space. Upper border of cardiac illness is detected at the upper edge of the third rib. Right border of absolute cardiac dullness is detected on the left edge, sternum at the fourth intercostal space. Left border of absolute cardiac dullness is detected in the fifth intercostal space. On auscultation, first heard sound in mitral and tricuspid point.
low pitch, long duration, synchronized apex beat, second heart sound in the aortic and pulmonary point. S2 is louder than S1, has high pitch, short duration, is synchronized with the apex beat, no systole and diastolic murmurs, absence of murmurs seen. Conclusion: cardiovascular system is normal, there is no dysfunction.
Now I'm going to carry out objective examination of the respiratory system. First of all is inspection. As I can see, the patient's chest form is normal, the thorax is symmetrical. Now I'm going to check the respiration rate of the patient. The respiration rate of the patient is 22 breaths per minute. Now I'm going to check for the vocal fremitus. Please say 99 every time I place my hands on your body. Is that okay?
Okay. 99, 99, 99, 99.
Please say 99 when I place my hands on your body.
99, 99, 99.
There is decreased vocal fremitus on the middle and lower part on the right side. Now I'm going to carry out percussion. There is dullness on the right side, particularly the middle and lower part. Now I'm going to auscultate the respiratory system. There is presence of wheezings and crackles at the right side of the lung. This may be due to presence of bubbles or sputum. In conclusion, the patient has tachypnea and there is pathology of the lungs. Now, I'm going to carry out genitourinary examination. First of all, I'm going to carry out inspection. As I can see, there is no hernia, everything looks normal, no swelling.
And there is no discharge on the abdomen too.
Secondly, I will carry out palpation. Is that okay with you?
Okay.
Do you feel any pain?
No.
Now I'm going to carry out percussion. Is that okay?
Okay.
After inspection, percussion, and palpation, there is no dysfunction in this system, but we would like to monitor the urine output of the patient. The urine output of the patient is low and concentrated. This is probably due to malnourishment. The patient is conscious and alert and able to carry out normal conversation. The GCS points is 15 points. There is no tremors and no numbness of any extremities. So we could say that everything is normal in the nervous system.
Hello sir, based on our subjective and objective examination previously, the primary diagnosis is still unclear. The symptoms that you have experienced such as fever, cough with whitish sputum, pale skin, general weakness and malnourishment are all signs of TB and a TB infection or a lung tumor. According to the objective examination done earlier, we have also detected a decreased vocal fremitus, dull sounds on both of your lungs, Also crackles and wheezing sounds heard on the right lower lobe of your lung. These symptoms are also characteristic of a TB infection or a lung tumor.
What should we do now?
To make a complete diagnosis, we have to carry out further laboratory and instrumental investigation. Is that okay with you?
Yes.
Okay.
Hello, I am Dr. Atira. Thank you for waiting. We have obtained your lab and instrumental result. Based on the lab test, it shows low hemoglobin, high white blood cell, high segmental neutrophil, and high band neutrophil which reach until 9%. So, in this case, we suspect there is presence of infection. Others are normal. For blood chemistry, the total protein is low, while lactate dehydrogenase, which is a tumor marker, is high. As for arterial blood gas, it shows that you have compensated metabolic alcoholysis with adequate oxygenation because you experience tachypnea. Others are normal. In urine analysis, the result is normal, but in sputum gram stain, there is a presence of gram-positive cocci insanely. We also did ABO typing, rhesus cross-matching test, hepatitis B, HIV, coronavirus antibodies, urine test, and glucose for preparation before surgery later. So this is the planned chest x-ray. As you can see, on the left side is the normal chest x-ray, and on the right side is your planned chest x-ray result. On your x-ray result, the shadow is visible. We suspect that there is a tumor on the lower lobe of your right lung, but you will need to do the CT scan so that I could examine the exact location, size and shape of the tumor. The result will be on 1 to 5 days. By the time the result is done, I will tell you. This is the result of spirometry. Spirometry produces a graph that shows your flow of air over time. FEV1 is the amount of air you can force out of your lung in 1 second. FVC is the greatest total amount of air you can forcefully breathe out after breathing in as deeply as possible. If your lungs are healthy, your FVC and FEV1 score are plotted on a graph that could look something like the left graph. As your lungs suspected to have problem in some way, your graph might instead look like the right one. So if your FVC and FEV1 is lower than expected, something is restricting your breathing. This is your ECG result. The result showed there were presence of ST elevation in your ECG, which proven there is problem in your lung. So that's all for today's result. I will see you in another 5 days for the CT scan result. Okay? Hello, thank you for coming. So here is the result of your CT scan. We observe that you have the size of the tumor around 3 to 4 cm. The shape is round and it is located on the segment 5, 6 and 7 intercostal space. After that, we also did scan the liver for metastasis, scan the brain for metastasis to check the severity of the tumor. So, the results show that there is no metastasis on the brain and liver because the tumor does not spread at that site yet. We also perform ultrasound on pancreas and kidney. So this is the result of ultrasound on pancreas. As we can see, the pancreas is on the normal condition and there is no metastasis on the pancreas. Next is the result of the ultrasound on the kidney. As we can see, the kidney is normal and there is no metastasis. To determine the stage and grade of your tumor, we need to do a lung biopsy. For that, we will do the bronchoscopy to reach the tumor and obtain the specimen of it. You will have to wait in 1 to 3 days to get the result. You will require hospitalization to get enough rest for several days after the lung biopsy. As you can see, this is the procedure of the bronchoscopy. Hello, as you were informed, your result for lung biopsy is ready. So after the cytology examination, it showed that you have low-grade carcinoma where the cells look more like normal cells and tend to grow and spread more slowly.
Okay, so for the final diagnosis and treatment plan, you have diagnosed with bronchial tumor at the lower right side of your lung. Suspected as a lower grade tumor or lung carcinoma. We did a cytological examination, and the lung tumor in your case is a primary tumor. And for the treatment plan, you have to undergo surgery. Before undergoing surgery, you need to do radiation therapy. Medicines will be also given, such as cyclosporins, and I'll also give you a link of a video which you can access in the internet at any time, which will explain the procedure to take the medicine. We'll also treat you with chemotherapy. So in the 7th day after your radiation therapy, we will proceed to surgical treatment to reduce the size of the tumor. By using radiation, we will shrink the tumor, or we can do surgeries called as lobectomy, which means remove a part of your lobe of your lung, or pneumonectomy, which means you will remove one side of your lung and you will just leave with one side of your lung. This depends on the situation after your radiation therapy. So do you understand?
Yes, doctor.
So are you ready for your treatments?
Yes, doctor.
All right.
So, sir, I think your question is if the surgery is important. Yes, sir, the surgery is very, very important for you because since you have a tumor can cause a lot of complications, sir. So what we do is we perform a lobectomy at the lower part of your right lung, and where we suspect the tumor is from the lab results. So the according to the lab results, sir, it shows that the surgery is absolute. If the surgery is not being done, it's going to risk your own life, sir. So during these surgeries, you usually use a general anesthesia, and then also when I talk about the risk, the surgery is very high in risk. So the surgery is performed through endoscopically. Endoscopically is when you insert a special manipulator into the chest cavity, into your chest, and it removes the tumor endoscopically, sir. So so you can ask me about the complications. The complications of this tumor are thromboembolism. Thromboembolism means there's blood vessels, blood clotting in your blood vessels are very, very high. The tumors can increase coagulation of the blood. Bleeding complication can also happen. All of these are complication of this surgery, sir. So if you don't mind, I need you to sign this consent papers. Thank you, sir.
Here shows the surgical report of the lobectomy surgery on the lower lobe of the right lung. During the surgery, the anesthesiologist will monitor the vital sign of the patient. The table shows the result of the patient's vital sign. The pulse, respiratory rate, blood pressure, temperature, and skin are all normal. Patient's consciousness is low as the patient is in surgery room under general anesthetic medication. The general anesthesia medications such as ketamine, propofol, fentanyl, and droperidol are used to keep the patient from feeling pain during surgery. The infusion therapy also will be given, which consists of normal saline solution, dextrose 5 solution, packed red blood cell, and fresh frozen plasma. These solutions are given to replenish the electrolytes and blood loss during the surgery.
Good afternoon, ma'am. Your surgery was successful. How are you feeling?
Good.
On a scale of 1 to 5, what's the pain that you're experiencing?
2.
Okay. Okay. Do you feel thirsty or cold?
No.
Do you feel nauseous or do you have the feel to vomit? Okay. I'm going to check your chest drainage. There's still some drainage, but there's no infection on the inside. It looks fine. I'm going to check your temperature. Your temperature is 37.2 degrees Celsius. You have slight fever. I'll be checking your respiratory rate. Your respiratory rate is normal. I'll be checking your blood pressure. Your blood pressure is normal. Now I'll be taking your pulse. Pulse is also normal. The IV will still be continued and you will still be on NPO diet for a while. Your antibiotics have to be continued for another 2 days. We will have to take an X-ray of your lungs and also draw out blood for blood analysis just to see how you're doing after the surgery. If you have any other questions or if you need me for anything, then you can call me. Hello ma'am, I have your results for your blood analysis and your X-ray. So this is your blood analysis for complete blood count, your protein, urine tests, and creatinine, albumin levels are all normal. And this is your chest X-ray. We removed the lower lobes of the lung where the cancer was located at. Although now you can, in a few days you can be discharged, it is still important for you to be closely monitored, which is why your next visit will still be with the oncologist. And during the visit, the oncologist will check your general state and your respiratory system and run some tests such as to check for tumor markers and do X-ray as well.